Hi everyone, myself Aruna, working as a nursing tutor in Sri Shanmuga College of Nursing for Women. Today we discuss the heart failure. Heart failure is the chronic condition where the heart muscles is the cardiac muscles, can't pump enough the oxygen-rich blood to meet the physiological functions of the body. The heart failure leading to the fluid buildup and the symptoms like shortness of the breath, fatigue, and the leg swelling. Definition of the heart failure. Heart failure is the abnormal clinical syndrome that involves the inadequate pumping or filling of the heart. Heart failure is the abnormal clinical syndrome that involves the inadequate pumping or filling of the heart. Causes of the heart failure. The cause of the heart failure: hypertension, myocardial infarction, coronary arteriosis, congenital heart defects. Congenital heart defects, the example ventricular septal defect, cardiomyopathy, and valvular disorders. Valvular disorders example mitral stenosis. Next we discuss the types of the heart failure: left side heart failure, right side heart failure, systolic heart failure, and diastolic heart failure. Left side heart failure. The left side heart failure, fluid may bake up in the lungs, causing the shortness of the breath. The left side heart failure, fluid may bake up in the lungs, causing the shortness of breath. The right side of the heart failure, the right side of the heart failure is the fluid back up into the abdomen, causing the leg and foot swelling. Next, systolic heart failure. The left ventricle, systolic heart failure is the left ventricle can't contract vigorously, indicating the pumping failure. Systolic heart failure indicates pumping failure. Diastolic heart failure indicates filling problem. The diastolic heart failure is the left ventricle can't relax or fulfill, indicating a filling problem. Left side systolic heart failure. Systolic heart failure indicates the pumping problem. Diastolic heart failure. The diastolic heart failure indicates the filling problems. The diastolic heart failure also called the heart failure preserved ejection fraction. Clinical manifestation of the heart failure: the left side heart failure and the right side heart failure. Left side heart failure clinical manifestations: pneumonic, the drowning, and right side heart failure pneumonic is the swelling. D for dyspnea, R for rates, and O for orthopnea, W for thickness, N for nocturnal paroxysmal dyspnea, and I for increased heart rate, and N for nagging cough, and G for gaining the weight. Right side heart failure: S for swelling of the legs and hands, W for weight gain, and E edema, the pitting edema, L large neck veins, L next lethargy or fatigue, next I for irregular heart rate, and N for nocturia, G for growth of the ascites. Diagnostic evaluations of the heart failure. The diagnostic criteria for heart failure: first we have to monitoring the electrocardiogram and the echocardiogram, complete blood count test, serum electrolytes, and the renal failure, and the NT-proBNP and terminal pro-B type of natriuretic peptide. Management of the heart failure. The medical management: one mnemonic is that DAD, BOD, and CLASH. DAD, the D for digitalis, A for AC inhibitors, and B for the dopamine, and BOND, the B for beta blockers, O for oxygen, and N for nitrates, and D for digitalis. In class, C for calcium channel blockers, and I for lifestyle changes, angiotensin 2 receptor blockers, and sodium restriction, and the hydralazine. Surgical management for the heart failure: implantable. First management: implantable cardioverter defibrillator, cardiac resynchronizing therapy, ventricular assisted devices, and the heart transplantation. The role of the nurse in the cardiac patient: the monitoring the vital signs and the ECG monitoring, daily weight monitoring, improving the gas exchange and the oxygen administration, improving the cardiac output status, managing the fluid volume, administration of the medication as per prescription. Complications of the heart failure: the complication of the heart failure: renal failure, liver failure, electrolyte disturbances, atrial or ventricular arrhythmia, atrial or ventricular fibrillation, thromboembolism, cardiac asphyxia, the cardiac death. Thank you.